Hi, what is the most critical thing to do when we have a PC tear? Well, we have got two primary goals to achieve in the event of a PC tear. Number one is to prevent the rupture of antihyaloid phase if it's still not disturbed. Number two is to prevent the enlargement of the PC tear. Now, how are you going to achieve this at every stage? The standardized protocol is to inject dispersive OVD after recognition of a PC tear. Then, the most important thing to do is to lower the bottle height as the infusion cannula is being introduced into the antechamber. This will ensure that there is no sudden deepening of the antechamber. If the infusion cannula is entered with a regular bottle height of 80 to 100 centimeters, which is usually set for cortex aspiration or emulsification, then it causes sudden deepening of the antechamber, which can result in A. Enlargement of the PC tear, B. It can also rupture the antihyaloid if it was intact until now. Let's look at few examples. In this case of PPC, the posterior capsular tear is detected. The cortex needs to be aspirated. With a combination of dispersive OVD placed in the antechamber and low bottle height, every bit of cortex is aspirated without rupturing the antihyaloid. The planned IOL is placed in the bag, and also the OVD behind the lens could be aspirated without rupturing the antihyaloid. Another case with posterior capsular tear, but this time with vitreous disturbance. Before beginning antivitrectomy, the bottle height is brought down to 30 centimeters. The vitrector is held below the level of the posterior capsular tear. The prolapsed vitreous is taken care of. The flow rate of the vacuum is kept low to compensate for the low bottle height so that the chamber equilibrium is maintained throughout. During antivitrectomy, during cortex aspiration, and even after putting the lens into the bag, the posterior capsular tear size remains the same. Now, time to remove the OVD behind the lens. Even at this stage, we could prevent the enlargement of the posterior capsular tear. The lens is sitting in the bag and the PC tear is not enlarged. So my 2-minute tip here is that in the event of the posterior capsular tear, if you're able to manage low infusion pressure, that is, we're able to go low and go slow, most often than not, we can prevent enlargement of PC tear and also prevent the rupture of antihyaloid if we're still intact. So watch out for the bottle height next time. Thank you.